Okay.
Good day, I am your student nurse Lau. May I know your name, age,
I am Nico Mabilog and I am 20 years old.
and what can I call you?
You can call me Nix.
Go.
So sir, we're going to get your sa to?
Temperature.
Sige, last.
Try na,
So
nag-record
today
naman.
sir, we're going to get your temperature, pulse rate, and respiratory rate, and your BP. So your respiratory. So your temperature, sir, is 36.2 degrees, and your pulse rate is 70, which is normal, and your respiratory rate is 20, which is normal too. So sir, we're going to get your blood pressure. We're going to auscultate your brachial. Now we're going to auscultate your brachial. Now we're going to auscultate your brachial pulse. So your blood pressure, sir, is 110/90, which is normal. First, we're going to assess your skin. Ay, tayo ba man? Last. Tayo ba, di ba? Di ba nagsuot-suot sa plato? Nalan. Sige. Ganda.
Yan, start na ba?
First, we're going to assess your skin, your odor, your color, lesions, texture, temperature, thickness, and mobility, and turgor and edema.
Start.
And next, we're going to assess your hair, your color, amount, distribution, thickness, texture, lesions, and parasites. And next, we're going to assess your nails, your color, shape, texture, consistency, and capillary refill.
Oh.
So, sir, we're going to assess your head and face. Now we're going to inspect your size and shape, normal configuration, the consistency and symmetry, the facial features, so no abnormalities, your expression, skin condition, so normal, and hair distribution, so well distributed, and color of hair, normal. So next, sir, we're going to palpate your head. And next, we're going to palpate your head, your temporal pulses, your your masseter muscles, and next we're going to inspect your joint mobility. So, can you open your mouth, sir? Close. So, can you open your mouth? Yung tao. Sige lang. Can you open your mouth, sir? Side. We're going to check side. Good. So, next we're going to check your cranial nerve number 5. We're going to assess your sensation. Say yes, sir, if you can feel the object. Can you close your eyes? Yes. 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 So next, I'm going to use a sharp object and say yes if you can feel the sharp object. Can you close your eyes? Yes. 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 So next, sir, we're going to combine the soft object and the sharp object, and if you can feel the soft object, can you say soft? And if you can feel the sharp, can you say sharp? Sharp. Sharp. Tubay. Balik na. Ano? Sige na. Sige na. Sige, sige. Tubay, uy. Sige, guys. Sige na.
Patay din, normal. Pwede na ba ito tumapadayon? Pwede lang ito.
Ano lang, uy.
Sige na lang padin. Kira to.
Stop. Sharp. Stop. Sharp. So, sir, your sensation is normal, sir.
Go.
So, sir, we're going to palpate your temporal artery. So the elasticity. Good. The tenderness.
Wait.
So,
Go.
so sa tenderness, na kayo na-feel sakit, sir?
Wala.
So far, normal siya. Wala siya swelling or gaburot-burot. And next, we're going to check your temporomandibular. Sige, pause ito.
Go.
So next, we're going to check your temporomandibular. Now, sir, we're going to test you the distant visual acuity by using the Snellen chart. Cover your right eye.
E F E T O Z L E E D D E C F D E E F C Z E F E L O D C E E E F E O C E C L E E O C F O C F E.
So next, we're going to test you the near visual acuity by using the Snellen chart.
E F E T O Z L E P E D E C F D E E F C Z E F E L O P V D G E F T P O T E C L E F O D F C E F E F F T O.
Now we're going to test your color vision by Ishara test for color blindness.
Okay.
So, sir, kung sa imong nakita diri nga color, sir, or number, kung sa imong
It's number 12. No, I'm going to cover my eyes.
mong balik. So, kung sa imong nakita, sir, nga number, you have to tell me. O is it to cover your left eye?
Yes.
So, what number is this?
12.
Next.
Number 8. Number 29. 29. It's number 5. 3.
Good. Right.
15.
Good.
74.
Good.
It's number 6.
Good.
Number 46.
Good. Now, sir, we're going to assess your ears. So, we're going to inspect the external ear structure. Inspect the auricle, the tragus, and the lobules. So, it's normal, it's good. So now, let's palpitate the auricle, tragus, and the mastoid.
Okay.
first the auricle, the tragus. Let's check if there is tenderness, masses, or swelling. So the other side, the auricle, tragus. So there is no masses or lesions. And now we're going to assess the endoscopic examination. So we're going to external auditory canal. So they are discharged. And next, let's check the other side. Now let's check for the tympanic membrane. Check for the color. Now let's check for the color, shape, extensive or marks. So there's no abnormalities or swelling. So it's normal as well. And now let's perform the whisper test.
Nico. Bilog. Mabilog.
Now we're going to perform the Weber's test. Now, sir, can you put your hands?
Go.
So, good day, sir. We're going to assess your nose, and we're going to inspect and palpitate your external nose. So, the color. So the color is good, and the shape is well shaped or well balanced, and the tenderness smooth, and the patency good. And next we're going to assess your internal nose. So the color is good. The swelling, there's no swelling. The swelling and exudate, there's no swelling. And the bleeding and ulcers, there's no bleeding and ulcers. And the performed septum or the polyps, none. So if you have a normal, nose.
It's all normal.
So it's not all. So it's all normal, sir.
Start.
So today, sir, we're going to assess you at cranial nerve number 1 or the olfactory nerve. So na ako'y ipasimot mo, sir, imong piyo mo na yung mata. reflexes with the liquid. Now we're going to assess your mouth and throat. Now we're going to do is to inspect your mouth and others. So can you see your lips? And we're going to inspect your lips, vocal, mucosa, and gems. Check if what is color, the moisture, the consistency or lesion. Banga ka? Ah. So far, so good. Next is the tip. Say open your mouth. So we're going to check the number of your teeth, the color, the moisture. Next is the we're going to assess the we're going to check the hard and soft palate, the color and integrity. Balik. So next is the uvula. Next is next is we're going to check the uvula. So, the color, the shape. So normal or it is- So the color is normal. Next is we're going to check the gag reflex. And next is we're going to check the tonsils. The color, the shape, the moisture. Lagi pa pa. Sino? Bubuhay ng unos din. What's up yun? Ano yung mga vermi? So next. So far, so far the color is normal. Next is the same. We're going to inspect this. Next is we're going to inspect and palpitate the sinuses. So the front, simulation, the masseter sinus. Now we're going to percuss. Now we're going to percuss the sinuses. Dire? Transelimination, transelimination, masseter. So the sinuses are normal. So the frenulum, so the cranial nerve number 12, which is the tongue strength. So can you open your mouth? Can you left him up, right, up, down, good. So ano the patient is kind of glance. So your tired glance. So normal resistors, and next we're going to check your relative glance. So good.
Go.
So sir, we're going to assess your arms, hands, and fingers. And we're going to inspect and palpate your upper extremities. Now the coloration. So wala sa galispad sir. And next the texture. Good. The moisture. There's no dryness in your skin. And the masses. So next the lesions. There's no lesion. And the muscle size. So normal is here. So next we're going to palpate your nail bed. So good. And the shape. Good. And next we're going to test your cranial nerve number 11. So it's called the shoulder shrink. So the second. First, we're going to assess the posterior and lateral thorax, and we're going to inspect the shape and configuration, the position of sculpture, the rate and rhythm of respiration, use of accessory muscles, and client posture. And next, let's palpate the spinous process if there is tenderness, sensation, or any masses. And next, let's palpate the posterior lateral thoraxes. Let's check if there are tenderness, sensation, if there is lesions, masses, or tactic firmitus. And next, let's perform the chest expansion. Okay, bro. Okay. And next, let's percuss the tone and the intercostal spaces.
Go.
Now, sir, we're going to assess your wrist. We're going to inspect and palpate if there is swelling or nodules or ulcerations. Makafeel na kayo ma-feel sakit, sir? Wala naman. So your wrist is your wrist is normal. So nasad ko yung tips or ma-advice sa mo, sir. So if na kayo ma-feel sakit sa mong wrist or na magmulmul, mas better mo sana. Now we're going to assess your abdomen. So the first thing is to inspect your abdomen. So your color, so is normal. The vascularity, good. The pigmentation, good. The stray, good. Scars, there's no scars. The lesions, rashes, so there's no lesions or rashes I can see. And the contour, so there's no contour. So it's normal. So next we're going to assess or inspect your symmetry. So the abdominal movement. So your abdominal movement is normal, and your respiratory movement is normal at all. So now we're going to inspect your umbilicus. So the first is the symmetry. Next is the contour, and the color is normal. So we're going to auscultate your bowel sounds. So the intensity. So the pitch. So you have a normal pitch, and the frequency. Now next is we're going to auscultate again your muscular sounds. So the abdominal aorta is normal. The renal artery is good. Next is we're going to check the iliac arteries and the femoral arteries. So there's no abnormality sounds. Now we're going to percuss your tone. The right lower quadrant, the right upper quadrant, your right upper quadrant, your left upper quadrant, your left lower quadrant. Next is we're going to inspect your liver. So let's locate your liver. So let's check the location, the size, the liver span, and next is we're going to inspect again your spleen, the location, and the size. So it's all normal. Now we're going to do the blunt percussion. So First is the liver. Next is the kidney. Next thing we're going to do is light palpation. So the first thing is the umbilicus. Next is the abdominal reflex. So the next thing we're going to do is the abdominal quadrants. So first thing to do is the right lower quadrant. Next is the right upper quadrant. Now is the left lower quadrant. And the left upper quadrant. So next thing to do is to do a deep palpation. So first thing to do is the abdominal aorta. So we're going to if there is a consistency or tenderness. So the next is the liver. So it's all normal. So next thing we're going to do is spleen location. So if there is, we're going to search if there is a consistency or tenderness. Good. Next is we're going to check the kidneys. So the kidney punch or the tenderness. Next is the urinary bladder. So normal. So there is no abnormalities. And now we're going to assess the legs, feet, and toes. And now we're going to inspect the lower extremities, the skin color, the texture, the masses, or the variosities, or the distribution of hair, lesions, edema, or musculature. And now let's palpate the skin temperature. Good. The edema. So you have no lesions, there's no signs of edema. And next, and now let's check the pulses, the popliteal, the dorsalis pedis. Agoy, buguan. Now let's assess the pulses, the popliteal, the dorsalis pedis, the tibial pulses, and the femoral pulses.
Stop na.
And now let's perform the ankles. First, the plantar flexion and the pain sensation.